I'm in the stars tonight, so watch me bring the fire, set the night light. Shoes on, get up in the morning, cup of milk, let's rock and roll. King Kong.
미안. this, you do it carefully, okay? You spread it carefully, properly.
摇一摇，体操开始，1、2、3、4。啦啦啦啦啦啦啦啦啦啦啦啦啦啦，甩甩手儿，啦啦啦啦啦啦啦，松松松松松一松，松一松，松松肩膀，松一松。
接下来，长颈鹿。
海边里有的。小大
Ho, ho, ho! Hi, kids! Merry Christmas! 圣诞快乐！
恭喜恭喜，牛年行大运！
Cause I'm in the stars tonight. So watch me bring the fire, set the night light. Shoes on, get up in the morning, cup of milk, let's rock and roll. Kink out.
Neil, what is the number before Dora? 2. 2. Very good. Next, Neil again. Where is Dora? What's the number? Yes, 3. Okay, very good, Neil. Okay, so always remember you look at the number before. That's how we look at the half an hour.
Say rainy. And of course, stormy. Stormy. Right. Very good. Very strong rain and wind. That's storm.
it's so close to the point that many of us have been attending masses, saying prayers for friends and loved ones every day and for the last few weeks. So we all hurt. We all grieve, and many of us are feeling depressed from all the bad news, one after the other. And even more alarming is the fact that even if we want to, even if we can afford to, it's been a challenge to have our loved ones confined to a hospital that could take care of them. The hospitals are full, and patients are being turned away. So many of us are forced to confront COVID and its situations inside the confines of our homes. So your alumni association then decided that it is best to take the bull by the horns by providing necessary information and guidance to help us cope with COVID situations in our homes. As Father King mentioned, you have a plethora of news, whether it's true or fake, all over the place, that it's so hard to discern. So at least here in this particular webinar, we will have the experts discussing what is appropriate and what we should be doing. I'm grateful for the core group. This webinar was organized so quickly in a very short span of time. So it took a very few Judenite individuals to actually focus on working on this. So as Mark mentioned some of them, I'm very grateful to our secretary, Jayan Lee, and the ever competent Dr. Roslyn Ko Di Chao, who was one of our first contacts, at least in the Philippine General Hospital, when we were starting our campaign to send PPEs to the various hospitals where Judenite alumni were present. And to help us with all the graphical images and content is one of our board members, Karen Ongsi. They helped us organize this webinar in a very, very short time. We are also very thankful for the ever helpful Judenites who are helping us in both speaking and moderating roles for this event. So you got the likes of Father Mark, Dr. not Father, Dr. Marco, and the
Research Institute for Tropical Medicine, or RITM. Dr. Amel is an assistant professor at the St. Luke's College of Medicine, the past chair of the Committee on Immunization of the Philippine Pediatric Society, member of the Department of Health National Verification Committee on Measles Elimination, and head of the sections of pediatric infectious diseases at three prestigious institutions, namely St. Luke's Medical Center QC and BGC, and the Quirino Memorial Medical Center. Our time constraints will certainly not do justice to her numerous achievements, accomplishments, and accolades from her lengthy curriculum vitae. We are indeed so fortunate to have her with us today. So to grace us with her talk entitled Coping with COVID at Home, please join me in giving a warm welcome to our distinguished speaker, an esteemed colleague, and most of all, a dear friend to my sister. Gentlemen and ladies, Dr. Imelda Acetre Luna.
Thank you, Mark. Thank you for that kind introduction. I would like to thank St. Jude Catholic School Alumni Association for inviting me for this talk, specifically Dr. Roslyn Dichow, a good friend of mine. Let me just share my slides. Wait lang. Can you see my slide?
Not yet.
Not yet. Wait. Wait. What happened? Wait. 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 Okay. Do you see my slides already?
Yes,
Yes.
you can go ahead.
So my sound is okay?
Yes, Doctora, very good.
Okay. So good afternoon again, everybody. Happy Mother's Day to all mothers out there. Again, thank you, St. Jude Catholic School Alumni Association and Dr. Roslyn Dichow for inviting me to give this talk. So my topic is coping with COVID at home. As a pediatrician, I deal with children's illnesses, but this pandemic has changed that. One family member getting infected exposes the whole family of possibly getting infected. Teaching family members on the timing and how to isolate and quarantine is of paramount importance to prevent further spread of the infection. This lecture is primarily for those who opt to do home care for COVID-infected family members instead of them going to isolation facilities or the hospital. Children and the elderly since the start of the pandemic have been advised to stay home. If they do get infected with COVID, it usually comes from exposure from adults who go out of the household to work or do errands. Adults going out should remember that they are continuously exposed to COVID. If one is not careful, one can bring the virus home and infect their loved ones. This will be the outline of my lecture. Current status of COVID in the Philippines, factors that affect transmissibility of the virus, what is the difference between isolation and quarantine, and how do we apply this on the families affected by the virus? I will also give you case scenarios that families experience and how you as a family member can help isolate and quarantine. Also, we'll be talking about guidelines for families infected with the virus who opt to do home isolation. And lastly, who do we call if families need assistance? Those who cannot afford testing, no place to isolate or quarantine. This is the weekly cases by date of illness from March of last year until May of this year. There was a surge of cases last year from July up to September. It stabilized by November to February. But starting March this year, there was another surge of cases, higher than last year, and we attribute this to the different variants of the virus. The surge in cases has resulted in hospitals being full, resulting to managing COVID cases at home. Everyone listening right now, I'm sure, has a relative, a friend, a colleague who had been infected by the virus. In several Viber groups, we've come across daily prayers for infected colleagues, friends, and relatives who are hospitalized or who lost their lives because of COVID. Majority of COVID cases occur in the young adult population, 20 to 50 years old, those in the working class. This age group has the most recoveries as well. But if you look at the number of deaths on your right, majority of deaths occur from the elderly above 50 years old. Children, luckily, are the least affected, both in getting the disease and the number of deaths. Majority of the illness is still mild, a few of them asymptomatic. Asymptomatic means infected but no symptoms. The reason I am showing you this is because home isolation is primarily for those with mild symptoms and asymptomatic COVID. Right now, because of the unavailability of hospitals, some are already managing even moderate COVID cases at home. Managing COVID at home should be under the supervision of a doctor. We all know that SARS-CoV-2 is spread through person to person, primarily through respiratory droplets. Transmissibility of the virus is dependent on the following: whether the people involved were wearing masks during the encounter, how near was the infected person to the other person. WHO and the Department of Health recommends 1 meter or 3 feet physical distancing, while CDC prefers 2 meters or 6 feet apart. How long were you exposed to the infected person? Acceptable duration is 15 minutes or less. Some guidelines place it at 30 minutes. Most importantly, was the place ventilated well when you were exposed to the infected is better than an enclosed space. It is difficult to apply the principles of transmissibility in our homes. We do not wear masks at home, although the Department of Health has already recommended that people who are going out should wear masks even at home. But in general, people do not wear masks at home. We are in close contact with one another because we eat at the same time. We sleep in the same bedroom. We share the same bathroom. We stay at home for long periods of time. Our homes are considered an enclosed space. Though we have windows, most of the time these are closed to avoid dust and when our air conditioning units are on. This is a household that has the 3 C's: crowded, close contact setting, and closed space with poor ventilation. Space and number of household members are determinants of how easily the virus can be transmitted. The closer you are to one another, the more people there are, the easier for the virus to spread. Not all households are created equal. Some households have very limited space, like the family of A, or there may be enough space but too many household members, like the family of B. When it comes to space and number of family members, it is the families of C and D who will be able to do better home isolation and quarantine. For those who cannot do home isolation because of lack of space or by choice, they are referred to temporary treatment monitoring facilities or COVID Ligtas centers. In Quezon City, these are called HOPE facilities. These treatment facilities are for those who are infected with mild symptoms or no symptoms. Home isolation is primarily for those with enough space at home, with own room and bathroom, and are stable. Stable meaning they should have no danger signs like difficulty of breathing, no changes in sensorium, and are able to eat and drink. If a family member is infected with COVID, be mindful that all household members may have been exposed and could potentially become ill later. Isolate immediately once with symptoms of COVID and while waiting for swab results. Children and other people can spread the virus even if they don't have symptoms. Remember that 2 days before the onset of symptoms, the person is already contagious. This is the pre-symptomatic phase. Most children do not appear to be at increased risk for severe illness from COVID. But people with comorbidities like hypertension, diabetes, obese, immunocompromised, or those with weak immune system tend to have the severe disease. We have to protect family members who are at high risk of having severe disease. Infections within a family home are usually staggered. The parent or household member who is not yet infected could take on the primary caregiver role for children to help minimize the chance of transmission. Remember that the risk of transmission is highest in the first few days of illness, when the symptoms are more pronounced. Isolate the infected, quarantine the exposed. What is the difference between isolation and quarantine? Isolation keeps someone who is infected with the virus away from others, even in their home. Quarantine keeps someone who might have been exposed to the virus away from others. The goal of isolation is to separate those who are contagious or nakakahawa from those who are not yet infected. Not all of those who were exposed will get infected. That's why we need to separate them from the infected. Quarantine corresponds to the incubation period of the virus. It counts the days when the symptoms of COVID may appear. It's an observation period of 14 days. This is the basis of isolation and quarantine. The viral load is the amount of virus you get if one gets infected. The period of infectiousness is the time you are contagious to other people. Incubation period is the time from exposure, kung kailan ka na-expose sa taong may COVID, up to the onset of COVID symptoms. The incubation period is approximately 14 days. 2 days before the onset of symptoms, the viral load represented by the red line is increasing and the patient is already infectious or contagious to other people. The viral load is very high from start of symptoms up to 3 to 5 days. Then it gradually subsides. It is best to test people with COVID during this time using the RT-PCR test. The virus is still detectable through the PCR test for several weeks or even months after COVID, or what we call the post-infectious phase, but does not mean that the person is still contagious. This could just be viral remnants. We do not recommend repeating the RT-PCR test to check for recovery of previously infected patients. We separate immediately those who have symptoms since they are contagious. We quarantine those who were exposed to the infected person. It is during this period of observation will we know if the person exposed got infected or not. As I've said, not all of those who are exposed will get infected. How long should an infected person be isolated? For those who have mild symptoms, isolation is 10 days from the start of symptoms, including 3 days of being clinically recovered and asymptomatic. Clinically recovered means that the person has no more fever and would not need paracetamol and the person has significantly improved. For those with Antibiotics should only be given if suspecting secondary bacterial pneumonia. In children, essential vitamins and minerals such as vitamin C, vitamin D3, and zinc as supplements may help bolster the immune system. There is insufficient evidence on the use of Lianhua, melatonin, or ivermectin in the treatment of COVID. The appropriate caregiver of the child should be a person who is in good health, non-elderly, and with no underlying comorbidities and immunocompromising conditions. If possible, infected persons should be in a well-ventilated single room and if available should use a separate bathroom. Limit the patient's movements in the house and minimize shared space. Household members exposed to the infected should stay in a different room, or if that is not possible, maintain a distance of at least 1 meter from the infected. All household members should wear a surgical mask when in the same room as the infected. All household members should practice hand hygiene, hand washing, or use of alcohol-based hand rub, following contact with an infected person. We should also teach children how to do hand hygiene. Use dedicated dishes, drinking glasses, cups, eating utensils, towels, and beddings. Cover one's mouth and nose during coughing or sneezing using tissue or inner part of the elbow or sleeves, followed by hand hygiene. Clean high-touch surfaces daily like counters, tabletops, doorknobs, bathroom faucets, toilets, phones, keyboards, tablets, and bedside tables. Use regular disinfectant or cleaning products. Children younger than 2 years old should not wear masks and face shield due to risk of suffocation. This also includes anyone who has difficulty or trouble breathing, with cognitive or respiratory impairment, and anyone who is unconscious or incapacitated. When do you seek emergency medical attention? If there is difficulty of breathing, seizure or convulsion or changes in sensorium, progressive abdominal pain, persistent diarrhea or vomiting with poor oral intake or signs of dehydration, fever and progressing rash, or a highly irritable child, or if there is worsening of symptoms. Other guidelines when isolating at home include: have only one person in the household take care of the sick person. This caregiver should not be at increased risk for severe illness. Caregiver of the sick should minimize contact with other people in the household, especially those who are at increased risk for severe illness. Caregiver for their sick person should be different from caregiver for other members of the household who are not infected. Avoid sharing personal items like phones, dishes, cups, utensils, towels, bedding, or toys with a person who is sick. Do not have visitors in your home. Do not let your child play with other kids outside the household. The sick person should stay in isolation until they meet the criteria to end home isolation. If the infected person has his own bedroom, which is the ideal, he should not go out of the room. Food will be brought to the room. Wash separately infected person's utensils. Separate laundry for his clothes. Do not shake dirty laundry. Use warm water. If need to go out on common areas, need to wear a mask. But what if you share a bedroom with someone who is sick? Make sure the room has good airflow. Place beds at least 1 to 2 meters apart. If this isn't possible, sleep head to toe. You may put a physical divider around the sick person's bed. If the home has more than one bathroom should be dedicated for use by the sick person. If the bathroom has to be shared by sick and well people in the home, remember that the virus can be excreted through the feces. The toilet should only be flushed with the lid closed. Surfaces in the bathroom such as countertops, toilet handles, doorknobs, and other frequently touched surfaces should be cleaned with disinfecting household cleaner after the sick person uses the bathroom. Keep toothbrushes, floss, facial wash, etc. away from the toilet. The sick person should wear a mask when using the bathroom if possible. Make sure the bathroom has good airflow. Open a window or turn on an exhaust fan. If the sick person can clean the bathroom after using, have them clean and disinfect it after each use. If this is not possible, the caregiver should wear a mask and disposable gloves and wait as long as practical after the sick person has used the bathroom before going in to clean. If the parent or caregiver is too ill to care for the child, look for a caregiver outside of the home with whom the child can stay. The caregiver should not be someone who is at higher risk for severe illness from COVID, as the child has likely been exposed to the virus. If, for example, you found a temporary caregiver to your child outside your home, the child should stay inside the caregiver's home until 14 days after their last close contact with a sick person. If the child gets sick, the caregiver should then quarantine for 14 days after the last day the caregiver had contact with a sick child. Our homes are considered an enclosed space. We need proper ventilation. Without ventilation, infectious aerosols can aggregate in the air. The greater the number of infectious aerosols in the air, the greater the risk to healthy people, even if they are further than 2 meters away from the infectious person. Respiratory droplets are heavier and fall to the ground immediately, while aerosol is lighter and floats in the air for long periods of time and can travel long distance. So ventilation is very important to remove aerosol in the air. How can we improve ventilation at home? Open the doors and windows as much as you can to bring in fresh outdoor air. While it's better to open them wide, even having a window cracked open slightly can help. Consider using a window exhaust fan if you have one. Turn on the exhaust fan in your bathroom and kitchen. Place a fan as close as possible to an open window blowing outside. This helps get rid of virus particles in your home by blowing air outside. Even without an open window, fans can improve airflow. Point fans away from people. Pointing fans toward people can possibly cause contaminated air to flow directly at them. Use ceiling fans to help improve airflow in the home, whether or not windows are open. For those in enclosed spaces with limited windows, consider portable high-efficiency particulate air or HEPA cleaner. This picture shows you what happens to a house after being visited by an infected person. The house above has poor ventilation. There is no open window, no fans, no portable air cleaner. The virus remained in the air for a long period of time, even 1 hour after the infected person left the house. The house below has good ventilation, open windows, ceiling fan, exhaust fan, blowing air outside, and a portable air cleaner. The viral particles have disappeared 1 hour after the infected person left because of good airflow. With good ventilation, the concentration of virus particles in the air will be lower and they will leave your home faster than with poor ventilation. Non-pharmaceutical interventions remains the same. Mask, hugas, iwas. But now we are also emphasizing the value of hanging labas or airflow to stand for ventilation, which is equally important. Even when riding a car, best to open windows for ventilation. What do we do for COVID-infected mothers and their newborns? They can breastfeed their babies. Mothers should cover nose and mouth when coughing and sneezing. Wear a mask, especially when breastfeeding. Wash hands before and after touching the baby. Clean and disinfect surfaces. What are the essentials needed when caring for an infected individual at home? Thermometer, with or without pulse oximeter, gloves, mask, alcohol, disinfectant, soap, tissue papers, paracetamol, cough or cold medications, vitamins, other maintenance medications, water or fluid or oral rehydrating solution, and designate in advance dishes, towels, beddings to be used. Emergency contacts list of family, friends, drivers, healthcare providers, employers, and the local public health department, and a notebook to write down the sick person's temperature and symptoms. For those who have symptoms of COVID, who would need financial assistance for testing or for hospitalization or for isolation or quarantine, call your BERT or Barangay Health Emergency Response Team. They can assist you in testing, monitoring symptoms, and if need to be hospitalized. If an RT-PCR is done on a family member and turns out positive, the local government unit is informed by the testing laboratory. The LGU will contact you and give you some advice on how to monitor symptoms, and they also offer free RT-PCR testing for all those who are exposed. The BERT can also help you look for temporary treatment monitoring facilities for those people who would want to isolate in these facilities instead of home isolation. This is an example of how the Quezon City app helped people with COVID symptoms. Other LGUs have this as well. They have advisories regarding COVID, QR code for consultation. They can assist you in testing, monitoring symptoms, and if need to be hospitalized. These are the contact numbers that you can call for assistance. Different numbers for different LGUs, or call 1555 for one COVID referral center. They can provide free testing for those who have symptoms of COVID, provide quarantine and isolation facilities if you need one. For those who need admission to a hospital, it will be worth calling One Hospital Command so they can assist you on what hospitals are available. There are also available free teleconsult centers launched by the Department of Health for COVID and non-COVID concerns. It is important that those who are doing home isolation will have a doctor monitor their symptoms through teleconsult. For those who are having emotional and mental health crises because of COVID, this is the National Center for Mental Health Hotlines. In summary, the surge of COVID cases is real. It is affecting not one but the whole family and several families. Once a member of the family is infected, he should isolate while the rest of the household should quarantine. You separate the sick and the exposed to prevent further transmission of the virus. Not all household contacts will get the disease. Isolate the contagious person, quarantine the exposed or close contacts. Isolation for mild and asymptomatic is 10 days. Moderate to severe is 21 days from symptom onset. Quarantine is 14 days from last day of exposure. Caregiver of a child or sick person should not be someone who is at high risk of having a severe disease like the elderly or those with comorbidities. Home isolation ideally should have his own room and bathroom and is only for mild and asymptomatic. If there is not enough space at home or by choice, one can go to temporary treatment monitoring facilities provided by the government. For those doing home isolation or quarantine, observe mask, hugas, iwas, hanging labas, or airflow. Disinfect commonly touched surfaces or things. Teleconsult with a physician regarding your progress while doing home isolation. Know the emergency signs and symptoms that should prompt you to go to the hospital. Know emergency numbers of your barangay or LGUs. We have to protect our family. Once you decide to do home isolation for COVID, we should continue to protect other family members of the family from getting COVID. Thank you for your kind attention. Sheshe.
Thank you so much, Dr. Luna, for that very informative presentation. And we now move on to the Q&A, and we would like to invite everyone to drop their questions at the Zoom chat box or for those watching on YouTube, just type in your questions. And this is truly a rare chance to be able to ask Doc Imelda. And of course, we would like to welcome back our panelist, Jane, and of course, my co-moderator, Doc Mark.
Yes, Valerie, thank you. And I hope you learned some new words in your vocabulary, Valerie, so I can test you now. So what does anosmia and ageusia mean?
Ay, nako. Yung anosmia cannot smell. Tama, di ba?
Very good. How about ageusia?
Teacher talaga si Doc Mark, di ba? Testing. Pero ikaw,
Parang
Jane.
St. Jude na St. Jude,
Yes,
Talagang,
yes.
ano to, buzzer mauna. Okay. Sorry, I'm busy namin din sa Viber. We were talking about Doc's
Presentation.
presentation nga. I think I listed quite a few questions. Wait lang, nawala sa notes kasi busy sa Viber. Okay. Doc, yung sinabi mo kaya earlier part, you said that even for post-infection, when you get tested, minsan lumalabas pa rin that you're positive even until 83 days.
Yes.
So what do you do pag ganyan? Kasi nakakapanik, parang tagal ko nang, are you really infected pa then? How do you gauge then?
So that's why for those who are infected and those with symptoms, so depending on the symptom severity, if asymptomatic or mild, 10 days of isolation will do. Meaning after 10 days, the person is not infectious anymore or is not considered contagious. So even if you repeat the test, it can still be positive up to 3 months. So we don't do repeat testing just to say that the patient has recovered.
Okay.
So depending on the severity, on how long will you isolate. So isolation is parang yun yung contagiousness period.
Okay. So I think it's also best that you coordinate with the doctor. Hindi to self-test na parang, kasi
hindi,
most...
Oo, sundot ka ng sundot sa ilong, positive ng positive, kawawa naman yung...
Oo. But Doc, like, one more, di ba ang dami ng COVID strains? So doesn't mean, what you said now, you don't recommend, even if you're asymptomatic, you don't recommend getting tested again. But what if you get another strain and you're again asymptomatic? Possible ba yun?
So after 3 months, no, di ba you get infected. So you can be positive for approximately 3 months and you're now well. But when 3 months has passed and you have symptoms again of possible COVID, you can get tested.
After 3 months.
But gumaling ka na, you have clinically recovered. Then after 3 months, if you develop same signs and symptoms, you can get tested again. Yeah. And
Doc,
when you test, di ba, una kasi, you just test if it's positive or not. Di ba? Positive ba siya sa COVID or not? And then the lab submits some of the specimens to the Philippine Genomic Center for checking of variants, but not all. So the lab selects specimens that will be submitted to the Philippine Genomic Center. So for example, a community has, parang biglang ang dami-dami dito sa community ito ang may COVID. So magtataka, ba't kaya ang taas-taas ng COVID dyan? So they submit specimens to the Philippine Genomic Center coming from this community. Or also for OFWs coming here, chine-check din nila for variants.
Okay. Doc, may nag-pop na question. That's actually my next question from Alfred now. That was what I was thinking as well. Ang dami kasi nagabenta, Viber or Facebook, mga antigen saliva tests. They do self-testing at home.
Okay.
Sa mga praning, di ba? Yung mga hindi makalintay na parang, I don't want to call now, or while we're waiting for them to come do home service, I'll test myself first para hindi ako mapraning. So what do you think of those?
Possible ba nagkamali ka? Like parang yung mali yung gawa mo ng yung saliva antigen or yung proper?
Meron ding technique. Kaya mas maganda talagang iba ang mag-work. So, magkaiba kasi yung saliva antigen tsaka sa saliva RT-PCR test. Okay? So, mas ang equivalent or what we accept is the saliva RT-PCR. Equivalent siya sa nasopharyngeal swab RT-PCR test. So we don't recommend the saliva antigen. What we may use, okay, for example, there is a shortage of nasopharyngeal RT-PCR, we can use nasopharyngeal swab rapid antigen test. Okay, so magkaiba siya sa saliva. Okay, so the rapid antigen test using the nasopharyngeal swab may be used if there is a shortage or there's no available RT-PCR test. But remember that if your rapid antigen test is positive, then COVID ka na. We treat you as COVID. But for example, your rapid antigen test is negative, but you have symptoms. We all know that antigen test is less sensitive than the RT-PCR. So you still have to confirm a negative rapid antigen test with an RT-PCR test. So merong may limitation yung mga test. So you just have to know what the limitations are. Kung positive, okay. Pero kung negative, hindi. But saliva antigen test is still not acceptable. Nasopharyngeal swab antigen test, yes. Saliva RT-PCR, yes.
So, Doc, you mentioned it, dapat it's done by a registered medical practitioner.
Yes,
Hindi talaga advisable mga home kits?
If somebody who knows, okay.
Okay.
So, for example, a nurse knows how to do it, a medical technology knows how to do it, a doctor knows how to do it. Basta somebody who was trained. Even yung barangay health emergency response team that goes to the houses, yung for free swabbing, train lang sila on how to do it. So somebody who is trained to do it.
Okay.
Okay. We have a follow-up question
Yes.
by Alfred. Same person na Alfred. When is the best time daw to do the antigen test, if ever?
Oh, the antigen test is best done during the first 5 days of
5 to 7, no?
Yeah.
Same
Yung,
then.
usually hanggang 5 days. After 5 days, nagne-negative na siya. Unlike the RT-PCR.
That's 5 to 7 days after you are exposed
From the onset of symptoms.
of symptoms rin. Okay.
Okay.
To do the test when you have symptoms, yeah.
All right, next question is from Mary Grace Libutan. If a child has been exposed and currently having fever and rashes in the hands, is it a symptom of COVID, and what should we do?
You mean the child was exposed to somebody with COVID?
Yes,
Yeah.
yes.
So possibly, yes. And for children, lately I've been seeing what we call multisystemic inflammatory syndrome in children related to COVID, and they present with fever and rash and conjunctivitis. So these are children who have been exposed to family members who had COVID. Minsan hindi walang symptoms, pero after several weeks bigla na lang silang mag-fever, rash, and conjunctivitis. So yes, it can be an indication of COVID also in children, the rash.
So pag ganun, kailangan ipa-swab test na? Sorry, Doc Mark.
Yes.
Again, okay.
And should be evaluated because MISC is children with MISC should be admitted. So kailangan ma-evaluate ng doctor. You can do teleconsult first with your pediatrician and then makikita naman ng pediatrician sa screen, di ba? And then the pediatrician will guide you if the child really needs to be admitted. But if she is considering MISC, I was part of the one who did the clinical practice guidelines for children. Since we have data that children with respiratory illnesses like pneumonia have low vitamin D levels, low zinc levels, low vitamin C. So for children, we recommend vitamin C, zinc, and vitamin D.
Okay, sorry, Doc, follow up lang since we're in this topic. So for the kids, vitamin C plus zinc, yan talaga ever since. Yan yung talaga I bought a lot for the kids, I stocked up. But you mentioned nga, it's not proven for adults. What are the preventive measures we can do for adults, for seniors, and then for children, babies?
Actually, if you look at the adult recommendations, they would just say supportive treatment, hydration, paracetamol, rest, and monitoring if there will be increasing severity of symptoms.
But Doc, pag wala pang symptoms, it's just your everyday life. You go out to work, you come home, like what do you do just to make sure you're protected?
Just the minimum public health standards, which is just wear mask, ventilation, physical distancing, and hand hygiene. Wala pa talaga.
Walang intake. So walang mga vitamins, mga ganyan.
Parang to prevent.
Yeah.
Sabi ko nga, wag na lang huminga para hindi
Sa bahay na lang talaga. Just sa bahay na lang talaga. Diba?
Pero Doc, talaga important ang sleep, no? Kasi like a lot of people watch online streaming shows.
Yes.
Yung the kids and my husband and my friends, wag magpuyat. For me, that's one of the very important.
Lack of sleep makes your immune system go down.
Okay.
So sleep is very important.
Next question.
Doc Mark?
Yes, there's a question regarding those who have lost some household help, like us. What's the protocol now when hiring new help?
Okay. So, yung mga galing yan sa mga provinces, what I advise is just to quarantine the household help for 14 days. If there are no symptoms for 14 days, pwede na siyang mag-work.
Doctora, in your talk, you mentioned that in some cases we do 10 days, in some cases we do 14 days. What's the rationale behind to make it clear for our audience?
10 days.
Some 10, why some 14?
Yeah.
They're big difference.
When we say
why not all 14 na lang?
So isolation means the person is infected, meaning the person is contagious. So if that person has only mild symptoms, we say isolate for 10 days minimum. So yung 10 days kasi yun yung nakakahawa pa siya. After 10 days, hindi na siya nakakahawa. Yung 14 days is for those who will be on quarantine. So when you say quarantine, ito yung mga na-expose or hindi ka sure sa history, like a household help coming from a province, hindi mo sure saan siya na-expose during the travel. So you quarantine them, wala silang symptoms. You just observe them for 14 days if they will develop symptoms. So the 14 days correspond to the incubation period of the virus. When you say incubation period, this is the time you were exposed to somebody with COVID and you develop symptoms. So kaya matagal kasi yung virus takes sometimes 2 to 14 days before mag-develop ng symptoms. Now, kung gusto nyo para hindi kayo malito, okay lang naman gawin yung 14 days. Kaya lang, di ba nakakaloka yung, alam mo yung mag-quarantine ka and mag-isolate for such a long time. Di ba may mental health issues yun. So ngayon, may mga studies na for mild symptoms, 10-day isolation is enough. But for quarantine, the best is still 14 days.
All right.
Can I, another follow-up question. Since we also started talking about household help, this has not been addressed often, but a lot of us have household help at home. We have drivers. Some are stay at home, some are stay out. How do we how do we deal with the drivers that go home? And next na lang after. Sige, first muna yung mga drivers or those mga boy natin who go home every day. How do we, what's the precautionary measures for that?
My driver is a stay out. So daily siya. No? So what I do is I always ask him if he has symptoms, and I told him to be honest if he will have symptoms. And then automatically sa car, the windows are open. Naka-open ang aircon pero naka-open ang bintana. Kasi ventilation is really very important. And naka-face mask ako and face shield. So, ventilation, mask, and face shield, I think that will be enough. And you really have to trust your driver to tell you honestly if they have signs and symptoms of COVID. For yung mga household help na, di ba, nagda-day off and all.
Yes.
My household help knows that when she goes on a day off, she will be on quarantine. And she has experienced this already. So, ayaw niya nang ulitin kasi maloloka daw siyang naka-quarantine sa kwarto with, alam mo, not going out, yung ganon. So, pero kung yung galing province, papasok pa lang sa'yo, yun, 14 days of quarantine, that's the best. Pero yung iba gustong mag-test, well, you can do testing on day 7. Alam mo yan, day 7 from quarantine. You can do testing kung gusto mo lang i-check kung positive siya or negative. Kung negative, you still have to continue observing the household's health for 14 days. Medyo kampante ka lang na ay negative, but still you have to continue the 14 days observation.
Okay.
Sorry,
go ahead. Hindi kasi,
something.
syempre, mom si Jane
Oo,
marami siyang
wait.
concerns, di ba?
I
Go.
also have friends, even cousins who...
Your mic is a bit parang...
Ayaw.
Go.
Clear? I have to go closer yata.
Closer, please, yes, better.
Okay.
Yeah.
So, the next question is actually, what can we remind our household help if we live in a compound, if we live in a condo? Kasi hindi mo maiwasan. So, parang yung iba pa, pag nahuli mo ng may symptoms or asymptomatic, matigas ang ulo, ayaw magpa-quarantine, it happens. So how, I don't know, I'm sure you've heard more stories like this. Maybe you can impart and share with us how to deal with these case studies. Ibang case studies naman to.
Actually, yung household help ko, I tell them, yung wag masyadong, wala mo nang chismis
oo.
or food. Tapos kung magde-day off man siya, actually, hinahatid pa siya ng husband ko sa kung saan siya pupunta. Para hindi na siya sumakay ng... Para hindi na siya
commute. Hindi na siya mag-commute, yes.
And then, susunduin uli siya kung anong oras siya dadating. No?
Parang anak lang, no? Hatid sundo.
And we remind her to, kahit sa pagmamamalengke siya, no? We remind her, of course, meron siyang... Kami na nag-provide nun, syempre, yung face shield and the face mask. And limited time lang siya mamamalengke. Alam mo yan, hindi yung one to sawa. So, just for a limited time. So, pwedeng wag mo nang makichika-chika and all. Kasi minsan pag chismis, akala, basta laging consider mo yung katabi mo pwedeng may COVID. So,
that's true.
Always be careful. Don't share your air.
Yep. That's true. Assume everyone and even yourself has COVID para safe tayong lahat, diba?
Yes, always assume talaga.
Yes. Okay, Doc, our next question is from Elaine Chua. Do you have any updates regarding the Indian COVID variant? Any information we need to know regarding this variant?
Yeah, it's I think today lang ba, it's already a variant of concern. So meaning medyo it's being investigated and being studied. Kasi when you say variant, ang question nun is that parang nag-mutate siya, di ba? So nagbago na naman siya ng anyo, no? Naging siyang mas matalinong virus. So the question now is it more virulent, meaning will cause a more severe disease, or is it more transmissible, mas nakakahawa siya? So yun yung problem with the variants. And ang next question din is, will the vaccines that were given to us be able to protect us from this variant? Basta today it has been announced that it is now a variant of concern. So they are still waiting. We're still waiting for the announcement or the statement from the World Health Organization on these variants. Pero yun lang. Siyempre, vaccination, will it be protected? Is it more transmissible? Or will it cause a more severe disease?
Okay, so I guess we have to read and wait for more information about it. Okay, next question is from Alfred Nang. Many families eat together during meals, so do you recommend they eat separately to prevent infection, especially for those members who regularly go out to work or grocery stores?
Yeah. I know of some families who are parang they don't eat together anymore. Pero ako, even if I go out and I do see COVID patients every day, I still eat together with the family kasi yun na nga lang yung time ko with them. Okay. But as I've mentioned, no, the Department of Health has already said na kahit yung mga lumalabas kailangan nakamask sa house, okay? And then kung pwede, yun, hiwa-hiwalay or magkakalayo kumain. Yun yung inaano nilang recommendation. And I know of some families who practices that. Pero ako, hindi pa. We still eat together.
Doktora, kawawa naman kung tayo mga doktora, no? When we go to
Isa pa,
when we come home, we have to mask again and isolate ourselves, no? Even my dog doesn't know me anymore.
Or even dogs can get COVID.
Exactly.
Yes.
That's why, no?
Actually, my brother's a doctor. Nandun siya sa kabilang room and they don't eat together with my parents.
Thank you so much for doing this for our country. Thank you so much. Di ba? Baka mag-iyakan eh.
So talaga, I mean, di ba, to eat alone, my brother in the other house, meron kaming connecting house. So doon na siya mag-isa whenever he's in.
Iba talaga.
Yes,
Yeah, yung ibang doctors I know, they have their own room na, yung gano'n. Parang nagsa-say hi, hello na lang siya from afar.
Yeah, kaya it's important to check on everyone talaga. The mental health is also an issue. Lalo na we're on our second year. Nakakakaba.
Affect talaga. Nakaka-affect
Yes.
talaga, yes. Okay, Doc, we have our next question from Beth Lim Chu again. How should we deal with staff who are hesitant to be vaccinated? Anong tips to be able to convince them? Kasi they're getting so many false information daw in social media.
Kasi usually, no, hindi yun, parang di kaya ng isang usapan lang. So, dapat ini-engage mo siya and explain. Hindi siya yung parang isang bagsakan. So, parang dapat nagkakwentuhan lang kayo. Ask them, what are their concerns? Why are they hesitant? And tell them yung advantages ng vaccine. Tapos, pwede mong sabihin that, yung polio nga, kaya wala nang may polio ngayon kasi majority are already vaccinated. Tapos, may mga na-eradicate na tayong disease like smallpox because of vaccination. And the vaccine, the COVID vaccine, will add another layer of protection from COVID. Okay? And then, parang, probably it will help us in getting out of this pandemic. And minsan tinatakot ko pa nga, how will you feel if you were eligible for vaccination and you didn't avail of it, and then nahawa mo ang nanay mo o anak mo and naging severe sila? How would you feel? Meron ka ng chance magpa-vaccine tapos hindi.
sa chat box rin. Clear ba? My sound? If you get, kunyari, your first dose of vaccine is different from the second dose, is that okay? Is the effectivity the same?
Sa ngayon kasi, there's no recommendation of giving another brand for the second dose. So ngayon, ang recommendation pa lang is same brand ang first and second dose. Wala pang recommendation that you can give another dose. We have to wait for that.
So you have to wait. Kunyari naka-first dose ka na, pero ang dumating na next vaccine is not the first dose that you got.
Bibigyan kung different brand, it will be the same brand. We have to wait for recommendations kung pwede na yung ibang vaccine ang ibibigay sa'yo. Sa ngayon kasi wala pang
studies. Kulang pa, no?
Wait for that.
Okay. We have the next question from Alfred. As a rule of thumb, can we say that all vaccines will work at full protection only 2 weeks after the second dose? Tama ba yun?
Yes.
That's
2
correct.
weeks after the second dose.
Pag first dose, do you have some sort of protection or it's as good as zero?
We're starting to produce antibodies, but it's not enough.
Okay. I think, Doc, like a lot of us, hindi pa rin nakaka-vaccine kami. I think it's good to share with our audience, diba? I think it's good to share with our audience what to expect when you get vaccinated. Maganda bang ihatid? Like my parents got, hinatid namin talaga. They didn't drive because nga pwedeng humina sila after the vaccination.
What to expect? Ano?
Yes. So we know also because, diba, we have parents and we have children. So parang we have to take care of our parents as well who are seniors. So what do we do? How do we take care of them? And even our husbands, our siblings who might need our help when they get vaccinated. And
So,
vice versa.
Yeah, yun lang sa mga vaccination centers. Minsan lang kasi pila, no? Usually sa mga public schools. So, pero majority of the public schools naman, open air naman siya. Kaya lang sobrang init naman. So, you just have to remind them na wag magtanggal ng mask, kumain before pumunta sa vaccination area at yung wag kumain doon or uminom kasi magtatanggal ka ng mask. And then wag makipag-usap sa kung kani-kanino kung hindi naman importante. And then may dalang alcohol like that. And then try as much as possible to have physical distancing with other people. It really takes time lining up in the vaccination center. Kasi may sinamahan na ako, ang tagal talaga, mga 2 hours.
Mm-hmm.
Although open naman, yung parang open gymnasium, gano'n.
Mm-hmm. Actually, my mother-in-law had her first dose din. Mabilis naman sa Manila LGU, it was fast, parang 30 minutes lang. So I guess bring candy na lang, no? Mga ganun, and fan, kung mainit.
So, kapag punta mo doon, para
yes, hindi mo na tanggalin.
Oo nga, no? Yes, tama. Yes. Doc Mark.
And go to the CR na before you go.
That's true. Tama.
Yeah, there's a question here. Perhaps they're not very clear regarding antibodies and antigen and IgG. No, so the question is a person who is tested positive for IgG considered less a risk to be with, since theoretically they do not harbor virus, since their antibodies destroy them?
So kung positive ka sa antibody test, it's just saying that you probably had the infection in the past. But does it provide full protection from the virus or the next virus? We do not know yet. So having antibodies, you should not be parang sort of, may antibodies na ako, pwede na ako hindi mag-mask and all. Having antibodies, you do not know how fully protected you are with those antibodies. So you still have to continue protecting yourself.
And what we do not know, in fact, is how long, no? The antibodies will stay with us, no? Even if you've been vaccinated and you get the IgG antibodies, you don't know how long.
Kasama din yan sa recommendations, insufficient evidence to support steam inhalation to fight COVID. And be careful ha, kasi baka magka-scald burn kayo. Kasi di ba mainit na tubig yun na hinihinga. So no.
Okay guys, you heard it na from Doc Imelda.
Diba? May isang question pa. Di ba noon, everyone was panicking on what to buy for the COVID protocols at home. Now naman, dahil emergency rooms are so full, lines are, di ba? Ang haba ng lines, some are being asked to go home na lang and then buy oxygen tanks. Now, kumakalat ngayon sa all the social media platforms, people are selling oxygenators. But what are your thoughts on that, Doc?
Just make sure you know how to operate it. And syempre, gagamitin mo lang siya talaga dun sa mga patients na who really needs it. But be careful lang kasi mamaya hindi nyo alam paano gamitin, sumabog yan, magkasunog pa kayo and all. So just make sure you know how to operate it.
That's the oxygen tank, Doc. But what about the machine na oxygenator ba yun? The one that compresses and parang di ba mas puro yung oxygen at home?
Kaya nga, there should be somebody supervising you.
Pati yun, hindi siya like a regular, like me, pwede ko gamitin. Kasi ngayon, everyone's selling na parang it looks like a home appliance. Diba?
Pulse oximeter pa, yes. Just to check your...
I have that rin.
Actually, dun sa home essential kit ko, hindi ko sinama yung oxygen kasi it's a drug, di ba? It's a drug. So, it should be used by somebody who knows how to use it.
Plus, I feel palagi paubos yung stocks niyan and I don't want to hoard. Parang there are so many people who need it parang in moderation. Like before, N95 lahat bumibili. Oh, ito, isa pa Doc, question. Like how long or how many hours do you use your N90? What's the best mask to use? Second, how long do you use it and then you throw away? Is it like for a day, 8 hours may surgical mask, you throw it na? Kasi some, di ba, lalo na nagka-shortage, ni-reuse, nilagay sa UV box.
For the general public, surgical mask is fine, even cloth mask is fine for the general public. But for healthcare workers, what we recommend is really the surgical mask for non-COVID wards. And then for COVID wards, naka-N95 talaga kami. Ideally, yung mga N95, usually mga 8 hours lang yon, or kung soiled na siya, you really have to throw it. Pero there was a time na nagka-shortage and even our hospital reused our N95. So, nilalagyan lang namin ng name and then ini-sterilize ng hospital at least 2 times. Parang 2 times mo pwedeng gamitin. Then they throw it away.
How do you sterilize it, Doc?
Merong way of sterilizing yung hospital They call it...
It's not the UVC. Yung mga ngayon kumakalat rin.
Yung UV light, probably you can use it, but I'm really not sure how...
It's called a plasma sterilizer. We have, especially for surgical instruments, you can also use, there's autoclave, of course, but these kinds of material, the masks, will not tolerate the autoclave. So we use the plasma sterilizer, and they're in the hospital. They cost millions, actually.
Nasisira siya kung mga autoclave or yung nasisira siya.
Question pa isa, Doc, like, di ba, face mask, face shield. Some wear that ionizer pendant pa. Some bring this machine na maliit na dehumidifier pa habang nag-meeting. May plasma ion pa. What are your thoughts on those?
Yung quintas, ano bang tawag doon?
Yung quintas.
Parang air purifier, parang wearable air card, parang ganyan.
Yes, yung mga yon.
It's not recommended and wala naman siyang basis or evidence that it can help. Yung mga HEPA filter, yung mga air purifier, it may help. Dun nga sa lecture ko, the CDC says it can help especially for those who have limited windows or yung limited ventilation sa homes. Yung mga air purifier or cleaner, okay lang yun. Pero yung mga quintas or kung ano-ano.
Sorry, one more since we're talking about disinfection because I've always been curious. Kanya-kanya kasi ito, I've never really heard from doctors, if ever pinopost sa mga YouTube, mga vloggers, like how do you disinfect, especially frozen food? Kasi basa na siya. So, parang, alcohol mo pa ba mga yun? So, like, how do you...
Wag i-alcohol.
Exactly. Parang, how do you disinfect the wet food?
Yeah, kasi actually kasi pag niluto mo siya, mamamatay yung virus naman.
Yeah, but Doc, it's wrapped in plastic. So that alone, I mean, if you're OC,
So you can remove the plastic, place it in another container, then store.
Yeah, kasi some would tell me they'd even washed out the plastic, the whole container, tsaka daw nila papasukin sa freezer.
Lang gagamitin mo, then yun yung iwa-wipe mo, then tsaka mo ilalagay sa ref. Pero better, tanggalin mo sa plastic, then place it on your own container. Then
But for the mga delata, like fruits and vegetables, how do you disinfect before you store them in your pantry?
Actually, pwede mo siyang i-stand sa labas ng bahay mo. Kung takot kang ipasok siya for 24 hours, then tsaka mo siya ipasok sa bahay mo. Or you can just wipe it and then that's it.
Even the fruits, Doc? Kasi fruit siya. So how do you?
Ano nga naman i-disinfect yung fruits?
Yun nga, kaya nga, Doc. So parang, how do you?
The usual way, you just wash it with water. Then that's it. Actually, yung yung surfaces, hindi siya ganun compared to
wearing a mask.
Compared to the respiratory route, yung surfaces is not a highly reliable way of transmitting the disease. It can, but mas less compared to yung magkaharap, yung respiratory route. So, mas less yung mga surfaces or yung food or not so much with that.
So that's what I read also, Doc. I just want to share. Yung sinabi nga dun sa study ng article na nabasa ko na people are so concentrated with disinfecting. Nakakalimutan nila that the most important thing is really to wear a mask. So it's like a good reminder for everyone.
I think also, Doc, since you talked about mask, what's the proper way of wearing it? Because some don't even use that nose wire. Parang hindi sila maingat. Parang just because they wore it, yun na. Or minsan lumalabas konti yung nostrils.
So dapat naka-cover yung nose and then partly yung chin. Hindi naman namin nire-recommend na mag-N95 ang general public kasi napaka-hirap niyang, kung natry niyo na mag-N95, kahit can afford mo siya, ang hirap siyang gamitin, hindi ka makahinga. So, for the general public, cloth mask, surgical mask is fine. So, dapat lang cover yung nose tsaka yung chin. Kasi madalas nakikita ko nakalabas ang ilong.
Yes. Oo, yun nga, Doc. Sorry, one more question because I've written about this a few times. Is it important to buy from na FDA approved? Kasi ang rami dyan binibenta na hindi FDA approved.
Yeah, meron mga FDA approved masks. Yeah. Tapos
so better.
Ito, hindi to FDA approved. Yeah, mahirap lang minsan i-check which is which. Pero yun kasi mahirap siya pag sa hospital setting. Dapat talagang nakaka-protect.
Okay, so we have so many questions. Talaga sobrang interesting ng ating discussion. And then we only have time for one last question, and that is from Father Belamide. What's the story so far about ivermectin?
For now, the latest guidelines from PISMID, it says there is insufficient evidence for the use of ivermectin, whether for treatment or for prophylaxis against COVID. So we do not recommend ivermectin as prophylaxis or treatment for COVID. But there will be a study that will be done in the Philippines, so we have to wait for the result of that study.
Okay, wow, what an interesting discussion. Doc Mark.
Yeah, very interesting. And perhaps, Valerie, we have taken so much of Dr. Amel's time, no? And everybody else. Our webinar is only for 4 to 6. We're 3 minutes to 6 o'clock. And we'd like to call on our president, to give his closing remarks. Thank you, everybody.
Thank you very much, Dr. Mel. It's been an interesting afternoon. I didn't really expected the intense interaction and so many questions. So thank you very much for sharing your valuable time with us. Kenneth, can we show the certificate of appreciation for Dr. Mel so that we can properly thank Dr. Mel? we'll send you the actual physical copy later. So right now, as a virtual copy, Dr. Mel, St. Jude Catholic School Alumni Association and St. Jude Catholic School awards this certificate of appreciation to Dr. Imelda Acetre Luna for sharing her expertise to the Judenite community, a speaker in the webinar Coping with COVID at Home, via Zoom Live and SJCS YouTube channel, given this 9th day of May in the year of our Lord 2021. Signed, Father Roland Aquino, SVD, our school director, and yours truly. So again, thank you very much, Dr. Mel. I would also like to show our certificate appreciations for the other members of our panels. So first of all, the mompreneur, as they call, is that correct? For sharing actually very valuable insights and concerns about handling situations in the home. If you were party to our Viber chat, you will see how intense the discussions are, and the need for us to be what they call OC, because really when we listen to Dr. Mel in terms of what the things we need to do, I really dread having a situation at home. But it is thankful for us to really understand it. So we're awarding the certificate to Ms. Jane King-Su Cheng for sharing her expertise to the Judenite community as a panelist in this webinar. So thank you very much, Jane. And also to our moderators, Dr. Mark Ko. Thank you very much also. We will send you this physically later on, as well as Valerie. Thank you also for helping us moderate this afternoon session. I think if we didn't have the three of you there, we probably will have, outside of Dr. Mel's presentation, a relatively boring event. But with you there, the energy level was very high, and I really am thankful for your participation. So thank you, Kenneth. So I would like to thank everybody for joining us and participating in this event. And I hope you found it valuable and helpful. And if you have time, please message us directly as to what other topics you'd like to be covered during Health Talks. Because I think there's so many things that we need to be able to learn and understand. As Father King said, there's so many things going around, whether true or fake. So discerning what is right or wrong is probably very helpful to us. And again, we're very thankful that we do have a lot of Judenite alumni in the health profession that can provide us all of these guidance. So thank you very much on behalf of St. Jude Catholic School and the St. Jude Catholic School Alumni Association. We gratefully appreciate your support for us and this webinar and the series of webinars that are going to come out. And I pray again that we will all be protected and kept safe from this pandemic. And as many are wishing, we are really hoping we go back to the old ways, not necessarily the old bad ways, but the old normal, so that we can go back and hug people, share a bit of meals with our friends, and actually embrace people again. So thank you. Have a good rest of your weekend and have a good evening. Thank you very much. Val?
Thank you so much to the president of the St. Jude Catholic School Alumni Association, Mr. Johnny C. And I just want to get a quick, final words from our panelists. Jane, any words to the parents, co-parents watching?
Sorry, I'm muted. Thank you, everyone. Thank you to the Alumni Association, to our school, St. Jude Catholic School, for having this event this afternoon. I feel it's very timely. A lot of parents are so overwhelmed in what to do. So yeah, thank you. This initiative is really how we will get through this COVID situation that we are in. Is really to help each other. So yeah, looking forward to more of these projects. Thank you.
Thank you so much, Jane King-Su Cheng. And Dr. Imelda Luna, any final words to our attendees?
Thank you very much for inviting me. So for everybody, if you're eligible for vaccination, have yourself vaccinated. but continue doing mask, hugas, iwas, hanging dapas. Thank you.
Thank you so much. Again, Dr. Imelda Luna and Jane King Socheng, thank you so much. Stay safe and stay well. And of course, I want to bring back the floor to Sir Johnny. Sir Johnny?
Yes. Thank you. I just want to recognize one other very important member of the organizing committee. So, Kenneth, if you can flash the certificate. Many of these things happen behind the scenes, as we call it BTS, not the Korean band, but behind the scenes. But we could not have done this without the able participation of the youngest sister of Dr. Marco, Dr. Roslyn Cody Chow. She has been really instrumental in providing guidance on where we need to go, what topics we need to talk about, and the people that we need to invite in order for us to have a fantastic seminar. So, Dr. Roslyn, on behalf of the St. Jude Catholic School Alumni Association and your alma mater, St. Jude Catholic School, we thank you from the bottom of our hearts. Right. Roslyn, maybe can we show her?
To serve my alma mater. Thank you.
Thank you very much, Dr. Roslyn. Right, back to you, Val. Sorry.
Yes, no worries. Thank you so much. Thank you so much for everyone who made this event possible. Doc Mark.
Nothing else, Val. Just congratulations to you and more power. I guess the message Dr. Mel wants to tell us is no lianhua, no ivermectin, mas hugas, iwas, and hanging labas. No? And everybody stay safe, get your vaccines.
Okay, so before we wrap up this session, I'd like to request for all our attendees to turn on their cameras so we can have a photo op. This will be the first of many, many more webinars to come for SJCSAA and SJCS. Smile!
Kenneth, are you taking the picture? All right. Good.
All right, good. Okay, again, thank you everyone for joining us in today's Health Talks, Coping with COVID at Home, presented by SJCS Alumni Association and SJCS. My name is Valerie Tan with
Dr. Ko, Dr. Mark. Don't call me uncle, buti na lang. Din call me uncle. Thank you.
Actually, konting age gap lang. Konting age gap
Dr.
lang.
Mark
Okay.
na lang, okay na yun.
Okay, thank you so much.
Thank you.
Wishing everyone a happy weekend. Happy Mother's Day to all the moms.
Bye.
Bye. Thank you.
Happy Mother's
Thank
Day.
you.